sets a huge precedent. It also it bypasses the PrEP Act. So the PrEP Act has been a huge hurdle to overcome. It basically, it's almost like the Vaccine Injury Act. It just makes it so hard to sue anything for anything that happened during the pandemic. And so this is a workaround. This is a way to hold people accountable that bypasses the PrEP Act. And the nice thing is we have 6 years before the expiration date. So the statute of limitations is 6 years, meaning that there's still time. Unfortunately, I still see new patients coming into my office on a regular basis who are not being reported to VAERS. Usually they've seen multiple other physicians and they are gaslit. They're put on psychiatric medications. These doctors don't even entertain the possibility that their new onset problems that occurred right after getting these mRNA shots have anything to do with this product that was rushed to the market with no long-term safety data. And they're not getting reported to VAERS. I'm the one that's reporting them. I will say a change that I've noticed since Secretary Kennedy has taken office is that I'm actually getting responses now from VAERS when I do report. Before, I would just report them and nothing would happen. But they're actually asking me for records. So that's a promising turn of events. What happens to these patients once they're reported to VAERS? Well, not really anything. After that, they have to go to the CICP. So it's a COVID-19 Countermeasures Injury Compensation Fund. And it's a fund set aside to help people that have been injured by these shots. Well, that is a futile measure. So I looked at the data last night. There are almost 14,000 reports, which I think is low because I think most people don't even know that they can apply to this program. But 14,000, and how many people have been compensated? 41. That's 0.2% of people have been compensated for their injuries. It's really disgraceful. It's really sad. I think, Chan and I were talking about this with President Trump. He just proclaimed that he got well, I guess he didn't proclaim, but the doctor stated in his report that Trump got a COVID booster. It's really unfortunate. This is a cold at this point. I do not worry about my patients with COVID. And even if they do get COVID, I give them treatment if they want it, but I don't even see the need to treat it like we once did. I mean, these people are not ending up in the hospital. So why would our most important executive subject himself to a product that at this point is completely all risk and no benefit? I mean, who is his doctor? Who is advising him? I never heard of this doctor before. I can't remember his name. And I'm ready. If y'all want to put him on, that would be great. Because I know Deb has a time crunch here. There you go. Hey, Deb and Warner, great to see y'all. I told everybody about the case. Give us an update. Where do things stand?
Well, I guess I'll start with that. The main thing that happened in this case, unlike so many others, is we got past the motion to dismiss. And throughout this crisis and even under False Claims Act filings, we always face a motion to dismiss. It's critical to get past that. Once you get past that, you get discovery. So we are now in discovery stage, and discovery just means we get their documents. We get to see how many people they vaccinated, so-called vaccinated, in the Rochester Regional Health System. And we get to see how many people came back injured following the vaccine. And actually, there does not have to be a causal connection. If you came back and were hospitalized after having had the vaccine, whether the vaccine caused it or not, it still triggers the need to file a VAERS report, a Vaccine Adverse Event Reporting System report. So Rochester Regional really has not met its burden under this, its duty under this to its own patients.
So what is it? So you're in discovery, and then does that mean it automatically goes to trial? Will there be a jury?
No, no,
Where does it
no.
go from there?
We have a lot of work to do. But the beauty of it is we're going to be able to see patient records. And I know
Mm-hmm.
that's going to probably concern some of the listeners, but we have, protections in place for patient identities. But we have to be able to identify who got the shot from Rochester Regional and who went back to that hospital system for services. We have an estimate. We
Okay.
estimate that at least 1,200 both got the shot and returned to the hospital system for a moderate to severe reaction. We know that
Wow.
many other people got the shot from Walgreens or CVS or some other location or the county. And out of that population, that's actually 12,000 people that we estimate went back to
Whoa.
Rochester Regional after a shot, not just from Rochester Regional, but 12,000 people had a moderate to severe injury according to the records that we've seen so far.
What are the records saying? How do you know? How are you able to identify that it's from the COVID shot?
Well, remember, it's not a causality issue. Anything that happens after you get the shot is questionable. And the way our system is supposed to work is that's supposed to be an early warning system. Certainly, some people came back for services without, maybe it wasn't a vaccine reaction. But if you're back in that hospital after you've gotten the shot for whatever reason, uh, the federal government is supposed to want to know that. And that's why Rochester Regional signed a contract to tell them about people who came back with some kind of issue.
Well, so are you just going purely by the timing, or I mean, like, say somebody comes in and they broke their toe, is that counted as one of these
Well,
potential cases, or?
no, obviously that would not be related. But if somebody came in having hit their head because they passed
Mm-hmm.
out and they had to be kept in the hospital overnight, maybe that was related. Do you see what I'm
Mm-hmm.
saying?
Right.
I'll give you the easiest one for people to grasp. I think everybody knows you got the shot, and many people, maybe most of them, got COVID after they got the shot. If they were
Mm-hmm.
hospitalized, that's a reportable event. So all the people who got the shot, then got COVID and were hospitalized, that's a reportable event. That's probably the easiest one to identify because that actually is related. It's related to the failure of the COVID shot to be effective. And guess what? The federal government, by law, actually should want to know that, and they're supposed to know that because that says this vaccine's ineffective. We shouldn't be using it. That's the kind of feedback loop that is designed in the law. And Rochester Regional signed a contract agreeing to do that. Basically, they completely ignored that and suppressed people like Deb Conrad who were trying to make these reports.
Yeah, Deb, how many reports did you file?
At this point, well over 200. At the point that I was fired, I think I got up to about 180. And to your
Okay.
point, Mary, what you were talking about earlier, interestingly enough, when I was filing these reports early on, I was always getting feedback from the VAERS representatives for records. That was one of my biggest frustrations, is because I was the one faxing all of these records. Because who's going to do
Right.
it, right? Nobody was taking me seriously. And to your countermeasures discussion, out of, say, the 200 patients that I have filed, only one applied to the countermeasures program and she was denied. If that just
Right.
gives the
Right.
listeners the scope of, how many people, and again, I'm not doing, I mean, these reports are serious adverse events. So these are things that these people are being hospitalized. It's affecting their life. Some of them can't work. Some of them are
Right.
permanently disabled. Some of them are dead. I mean, you know, to file the countermeasures claim is a process for these people in and of itself. And again, I told all of them about this program and only one applied because
Right.
it's a
Right.
system that just deters people. There's a lot of nuances to it. So it's really a shame.
Well, Warner, tell us, okay, what is the significance of this case, and are we running out of time?
The good news is that we are not running out of time. And it's really 6 years from the end of the EUA. This is a contract
Oh, good.
that was formed under the EUA. So I'm not sure right offhand what the date that they ended the EUA was, but I think we really have time until about 2029 to bring these lawsuits. So we have plenty more time to do it. And a question for your audience is going to be, who can bring these lawsuits? And let me tell you, an injured party who a hospital failed to report to the VAERS program that they were injured or that they had COVID and were hospitalized has standing to bring this. And in fact, under the Federal False Claims Act, we are all empowered. When we see a fraud upon the taxpayers, upon our federal government, which this was, then we can bring these claims. And one of the things that I've always thought about is that let's get groups of the injured people who had COVID or had some kind of other outcome that should have had a VAERS report that went to the same hospital, like the hospital you used to work at. Let's look at this. Yeah. Work with, I guess.
I did not ever work there, just to be clear. But yeah, Houston Methodist Hospital, if you got your shot there and then you had some sort of reaction, or heck, even if you got COVID, right, Warner? Like, is that
right,
reportable?
Exactly. Yeah.
That could be a huge lawsuit against Houston Methodist Hospital. That I personally would love to see that.
So what we should do is people who are hospitalized after they got the shot from Houston Methodist, they need to have gotten it from that hospital. That's kind of the key. But if we had 5 or 10 people who got the injection at Houston Methodist and then had to go back in for COVID or myocarditis or some other issue that arose, that little group could bring a lawsuit against Houston Methodist under the VAERS False Claims Act issue.
What do you think? I mean, okay, if you win the case, then what? What are the awards or the potential awards?
Well, it's very interesting. All the hospitals got an administrative fee per shot. So that amount, whatever they got, is tripled. And there's also a penalty of at least $13,000 per false claim, essentially. So that could very easily add up. You can see 13,000 times 1,000 is 13 million. And like I said, we think that Rochester Regional had about 1,200 that we know of that both got the shot and returned for services. So you're looking at a $13 million potential lawsuit. Now, most of that goes back to the federal government, but relators, that means the person who brings the suit or the group that brings the suit, get a percentage of that, anywhere between 25 and 30%. So if you return 13 million, the case could be worth something, could be worth something to the relator, $3-4 million potentially.
That's not chump change. I think that's worth doing. I mean, if people are interested in filing one of these lawsuits, should they contact you? Should they contact Freedom Council? What's the best avenue?
My preference is that they go to freedomcouncil.org and put their information in there. What we would like to see happen, there are about 2,800 hospitals in the United States. Out of all of those hospitals, the vast majority of them completely ignored their duty to the federal government. They completely ignored the duty to the victims and failed to make VAERS reports. So we think basically almost all 2,800 hospitals in the United States are liable under this theory of law. And the judge's decision in June was key because it's the first decision ever. This is the first case ever, thanks to Deb. This is the first case ever with this theory. The judge basically authenticated it and said, yes, this will work, let's go. So we know we have a good theory and we can start working on this problem with the vaccine injured if they want to. But they, like I said, group by group, little groups of people who know they've been injured, know a VAERS report should have been made, should join together and do this. And we'll help to coordinate it. If you put your information in, we'll see if we have other information from other victims at the same hospital. The other group that is working on this and that I've spoken to is React 19. You've heard of them, of course. So React
Right.
19 has an interest in this, and I believe React 19 already has about 35,000 vaccine injured people in its group.
Right.
It's just
Well,
horrific. What
Deb, thank you so much for doing this. What if the hospital wants to settle? Do you think you'll do it?
I don't want to.
The other thing I do want to point out for employees who got fired over this, if they got fired specifically for like what Deb did, they actually have a claim. So Deb does have a claim against the hospital that's personal, not public, but a personal claim for the wages that she lost because they fired her in retaliation for trying to do the right thing, in retaliation for doing exactly what the hospital should have been doing, in retaliation for trying to make them follow the law. I want to point out one other thing. There are criminal penalties for this violation. No hospital, no person has ever been convicted of a criminal penalty under this. But I really do wish our federal government would make some examples of people and say, look, you're criminally liable for failing to report this information to the federal government. These people ought to be held to account. That's another way to do it.
So that's a federal issue, not a state issue?
Right, it's a federal issue. Our attorney generals have to do that through the Department of Justice. It is definitely something that somebody should be made an example of, and get these hospitals to make vaccine injury reporting mandatory within that hospital, and hold them to account for what they should have been doing. I shouldn't say make it
So
mandatory. It is mandatory right now.
it's mandatory, right? Right. So what would that look like? Going after an individual doctor, maybe going after the CEO of a
I,
hospital? How would that look?
I think we should go after either the CEO or the institution itself. The institution can be held criminally liable, and that would be really important to make some examples of that. And the other thing is, I mean, especially in Deb's case, it was the management that purposely were suppressing the reporting. So they absolutely should be held liable.
Well, I think the perfect example to make would be the first hospital to mandate the COVID shots in the country, which would be Houston Methodist Hospital.
I
It'd
knew
be
you were going to
great
say
if
that.
Attorney General Pam Bondi, if we could get your attention, please. It would be great to look into Houston Methodist Hospital and how they did not report VAERS incidents to the government as they should have.
Yeah, they shouldn't. I think the federal government is minimizing this issue because, like I said, we believe there are 12,000 people who were injured by the shot that returned to Rochester Regional for healthcare. That's a tremendous damage to the public. And if this is how we can hold them liable for not reporting those injuries, we should do that.
Yeah,
I feel like
I mean,
I'm taking
it's
up
a
too
big
much
problem.
time.
No, but
Yeah.
yeah, it's. I mean, it's very frustrating to. I mean, patients are left high and dry. Doctors trying to help the patients are left high and dry. It's a very frustrating problem, and just really grateful that you guys are addressing this, and very hopeful. And please keep us posted. We will have you on again when you have some updates.
Oh, 100%. The trial is actually, this is going to take years actually to get through this data. So this is not a process that goes quickly. I think, we'll be looking at a resolution by trial or otherwise probably in 2027, believe it or not. So we have a long process ahead, but the
Well,
data is going to be fascinating to find and to see what's in that data.
can, can you use AI? I know you've talked about this, using AI to process the data.
Of course. AI can be very helpful. I mean, we don't trust AI 100%, obviously, but it can help you with the generalities that you need to know with vast amounts of data very quickly. So we can get to the
Mm-hmm.
generalities, and then we have to dig in and make sure we verify everything.
Right, right. Well, thank y'all so much for coming on, and good luck, and keep us posted. And thanks for giving us some hope today.
All right. Thank you so much.
Thanks for having us, Mary.
And when we come back, we are going to talk to Dr. Drew Pinsky. This was a really interesting interview. It went in places I did not imagine. We were going to talk about current events, and we didn't talk a bit about current events. We talked about drugs. We talked about alcohol addiction. We have some interesting information about Dr. Drew I never knew. You'll have to watch the interview to see. He's a very interesting guy, and I hope you'll stay on and watch. And finally, thank you so much to the Wellness Company. They are supporting this show. They are very like-minded. I trust them. I know the people that run the company. I know the doctors that are heavily involved in the company, and I trust all of them. So if you do need supplements, I recommend you use them. There is a code. If you put Mary on the end of the website, you get 10% off. But that helps them, and it helps encourage them to continue supporting this show so that we can bring you the unfiltered news and get spreading the word. So we'll come back in just a minute with Dr. Drew Pinsky.
And obviously, Werner Mendenhall, he's awesome. Deb Conrad is my heart and soul. She is right in my hometown, and I wish them all the best and all of the luck. They're absolute warriors. And, you know, we need to attack this issue and obtain our reckoning by any means necessary. So bottom up, inside out, everything but the kitchen sink. We need to move the culture. We need to move our families. We need to move in the courts, the judicial system. We need to move legislatively, whether it's at the federal level or the state level. And I'm always so glad to know that Werner Mendenhall is out there making these things happen. So best of luck. Great interview with those absolute warriors. I'm looking forward to hearing from Dr. Drew Pinsky as well. Dr. Mary Bowden mentioned the Wellness Company, and we are so thankful for their sponsor. We could not bring On Call with Dr. Mary Kelly Bowden to you every Wednesday without their support. And so she's right. If you use the promo code Mary at twc.health/Mary, that's twc.health/Mary, that helps to keep the lights on here at On Call with Dr. Mary Kelly Bowden. And I'm just really blessed to be producing this with Dr. Bowden. It's such a blessing and such really great information. So I want to talk to you guys about parasites. One of the things that I have noticed over the years, well, more recently, as you know, we question everything that happens within the medical industrial complex. Well, it's been known for years that parasites can cause all sorts of adverse events, sicknesses, illnesses, inflammation. And this is just basic knowledge. If you Google parasites or what parasites can do, it often comes up, that you can have inflammation, headaches, flu-like symptoms, cold-like symptoms, all the things. But if you go to your doctor and you have, something wrong, like a cold or a flu, they always go to virus and bacteria and virus or bacteria. They never talk about parasites. All right. So it's a great idea to think about doing a parasitic cleanse every year. And, if your brain feels foggy, even though you're eating clean and exercising and taking all your supplements, it might not be burnout or aging or sickness or illness. It could be parasites. So there's groundbreaking new research from Dr. Alan McDonald, and it revealed a direct link between chronic parasitic infections and neurological diseases like multiple sclerosis. Parasites can also cause, as I mentioned, inflammation, nerve damage, and long-term cognitive decline. So this is all the more reason to do a full body cleanse every single year. And the Wellness Company has a solution, ivermectin plus mebendazole. This is the gold standard in a parasite solution, and it's now combined in one cleanse, and this is an intense cleanse that is just, it's put together in this great combo. So it's designed to eliminate harmful invaders and support your immune system naturally. So it's medical grade. It is not some supplement or a trendy herbal gimmick. All you have to do is fill out a quick intake form and get a 3-month supply shipped straight to your front door. So the wellness company is making it as easy as possible to get what you need to stay healthy every day. And a parasitic cleanse is one of those things. So go to twc.health/Mary. That is twc.health/Mary, and make sure you use that promo code MARY to save 60% off plus free shipping. That's not 60%. $60 off plus free shipping. All right, cleanse your body today with the Wellness Company. All right, thanks, guys. We'll be back, or we're going to go back to Dr. Mary Talley Bowden without further ado. Her interview with the Dr. Drew Pinsky coming up next.
Today, I am thrilled to have Dr. Drew Pinsky, who is an internal medicine, addiction medicine specialist, and the host of the Dr. Drew Show. So welcome, Drew. And I have lots of questions.
Good. It's just a privilege to be here, and thank you for everything you've done and everything you've had to go through. I'm so grateful.
Well, before we get into the meat of it, I want you to know I looked you up on Grok. And I said, give me some interesting facts about Dr. Drew Pinsky. Okay. So apparently you're an opera singer. Is that correct?
I mean, I trained for many years. I used to get sort of sold at charity events and things to sing stuff. And then I sang national anthems for the Kings and the Dodgers and stuff. But to call myself an opera singer now, I'm not sure is an accurate description.
That is really cool. Do you still do it at all, like recreation?
I was in the Masked Singer about 6 years ago, season 2 of that. And when I was getting ready to prepare for it, I was like, hey, something is wrong with my whole, what's called the passaggio in the opera world is vanished. What's going on here? So I got a laryngoscopy. Lo and behold, I have a varice. I bled into that varice.
Oh, no.
I have reflux. I had to get vocal rehab and all this stuff.
Oh, wow.
And if I really want to get my opera back again, I'd have to have laser surgery, which would mean 2 weeks of silence, which I don't have.
Wow. Well, your voice sounds excellent, though.
Thank you.
Did you have a good ENT helping you?
I did. He was great. And he gave me a little mini lecture on how the chords moved. It was kind of fun.
Oh, good. All right. Well, the second thing I learned about you is you have an asteroid named after you.
It's true. So a super fan of my radio show was an astrology professor at University of Massachusetts, Amherst. And I went to college at Amherst College, which is down the road from there. Or maybe he was at Holyoke or something. But anyway, he became obsessed with us. And both Adam and I both were given asteroids.
That's really cool. Is that asteroid? I mean, do you track it? Do you know where it is?
No. I thought it was a lovely gesture, and that's where I kind of left it. But it comes up once in a while.
All right. You have triplets. That's very cool.
Yeah. You survived that somehow. I don't know how. And now that we have a grandchild again, we're having PTSD, flashing back to all that, and still don't know how we survived it.
What's it like being a grandfather? Is it much easier? Is it what they say?
No, it's easier. It's weird. It just smacks of old. And but it's lovely. It's everything everybody says it was, and I'll just tell you a quick story about surviving triplets. We had this brilliant high risk obstetrical team, and the guy that was our team leader sat us down, and he goes, he became a good friend of mine, and a neurology friend of mine described his knowledge base as encyclopedic. And I thought, yes, that describes his knowledge base. And he sat us down. He goes, don't do this. And we're like, huh? He goes, I will get you 3 healthy babies. I will deliver 3 healthy babies. But he just pushed across the table. Let me show you the literature on the probability of marriages not making it,
Whoa.
the mental health of everybody and the relationships suffer. Don't do this, have twins. And we just couldn't do it. So we had triplets.
Wow.
Yeah.
Yeah, that's, I had a similar experience. I had fertility issues. I actually have 4 kids. And the first one, was a struggle, and it just got easier and easier. And the 4th one was a whoopsie, right? And my OB has 4 boys, and I have 4 boys, and I had my first one. I had my last one 5 years after my first one, so I had him really compacted. But he pulled me aside. He's like, "Are you sure you want to do this?" Like,
yeah. I mean, I felt like a poker player. Took all my chips and just went, okay, we're just all in. If you really go all in, and obviously you and I have had some professional training and shown that we can tolerate a lot of stress, that you just go all in and you can do it. That's all. And I wouldn't have had it any other way.
Yeah. Yeah. No, I'm horrified that conversation even happened in retrospect.
Well, I get why they do it. They feel kind of an obligation to it and stuff. And the literature was there. It did not look good. And it's funny, when I was a chief resident, the assistant administrator and I ran the residency program. She was instrumental help to me. And halfway through the year, it was like, December, she comes up to me and she goes, "You got to meet in my office. I have something I got to tell you." And I go in there and she goes, "I'm not going to be here the second half of the year." I thought, God, what am I going to do without her? And then she goes, "I'm having triplets." And I thought, oh my God, that's bizarre. Who has triplets? I was like, triplets. Oh my goodness. And I bring it up only because of God has a way of
right.
has a good sense of humor, let's say. And her marriage didn't make it. And I remember watching that and going, okay, well, there you go.
Wait, was she a resident when she got pregnant with triplets?
No. She was the assistant director of the residency program, and then I was the chief resident, and she just really helped me run the program. It was it was a very intense experience to running a residence. I don't know if did you ever do a chief year?
Well, you were automatically a chief. I mean, if you survived your 5th year, you were a chief. So it was, we were all the same footing. I mean, but you studied internal medicine, right? And then did you do a fellowship in addiction, or did you just sort of decide to hone in on that?
That's an interesting story too. I started moonlighting at the psych hospital. I was neuroscience and brain was always my thing in college. And this opportunity came up to moonlight at a psych hospital when I was a 2nd-year resident. I thought, oh, I'm going to go do that. It'd be interesting, get to sharpen my psychiatric skills. Little did I know I was going to spend over 30 years in that hospital.
Oh, wow.
And ended up becoming very good at the medical management of psychiatric patients. And then, of course, all the medical problems that I was being asked to see as the years went along, down on the drug unit. I got very good at drug withdrawal. There was a program director of that chemical dependency program at that hospital who made drug withdrawal a discipline. And I worked at a county hospital with alcoholics and heroin addicts all over the place. And it was an absolutely haphazard sort of process, how you got people off drugs and alcohol. And I was shocked to find out that there was a procedure. There was a not well established yet, but a clinical procedure. And I became quite good at that. So people started asking me to see lots of these patients. And
wait, what was the clinical procedure?
Well, a structured approach, a disciplined approach, evidence-based approach to taking people off particular substances when they're dependent. For instance, I was seeing well into the early 2000s, I would see people in alcohol withdrawal getting Haldol. Mm-hmm. That was a common thing at the county facilities where I worked. And that's how you get an alcohol withdrawal to hover over the bed and have multiple seizures. Mm. Give them an antipsychotic like that, and you will make them so ill. And instead, we had a structured protocol for how to load people up on intermediate acting benzodiazepines or short acting benzodiazepines if they had liver disease, and a specific way of tapering them down over time. And then we had other, there was, a discipline to it. We gave them magnesium and thiamine and all the usual things, but it was done in a very, very systematic way.
What do you think about Alcoholics Anonymous? Are you a proponent?
To not be is mysterious to me. First of all, it's the cornerstone of every good treatment program. It's now, there's now 2 Cochrane studies, I think, and one for sure done by John Kelly at Harvard, showing that it's benefit, if abstinence is your goal, 12-step mutual aid societies are more effective than any professionally more effective or as effective as any professionally managed interventions. And it's free. And it's available 24/7. And why we wouldn't be advocating for free services that are measurably effective is shocking to me in a time when healthcare expense is a big deal. So our program was based in 12-step, and it was, I went from being down in the unit to detoxing people from drugs, going, oh, I do the medicine here. What's that goofy stuff? All that stuff on the wall, those 12 steps. What is that goofy stuff? And then I watched some people recover and go from young people dying to better than they ever knew they could be. And I was so stunned to see those transformations. I just thought, I want to understand what this is, and became quite good at that eventually.
You have any thoughts on legalizing marijuana? Because my big concern with marijuana, and I have some family members with schizophrenia, is the potential for psychotic episodes. Yeah. You have any thoughts on that?
Oh, I have lots of thoughts. So I have tried to stay out of, as a physician, I don't feel it's my job to determine the laws. I have on the record that if anyone chooses to legalize it, there will be problems, and I will deal with it. It will not be good. Strangely, when Colorado legalized cannabis, the only way we were able to get people's attention was by pointing out that the incidence of ER visits for dogs had skyrocketed because of ingestions of cannabis. We eventually saw that in California when that came in. And my daughter's a recovering cannabis addict, and I see cannabis addiction every day in that world. And I was a skeptic about the psychotogenic aspect of the drug. Back in the 90s, when it started coming up as a topic, I was like, I'm not really seeing that. I don't know. People got paranoid in withdrawal. They'd be very paranoid for about 2 weeks in cannabis withdrawal. But I thought, I don't know. It's probably people with schizophrenia who had a precipitated event or something. Now there's absolutely no doubt. It causes manic psychosis, 100%. Absolutely no doubt. And this is evident now because of the incredibly high concentrations that have come along in the legalized states as a result of the competition to get more market share. The concentration of the drug has gone higher and higher, to the point where now we are categorically seeing psychosis, much higher incidence of addiction, particularly if you're doing dabs or concentrated wax, that sort of thing. And ERs are filled with 65-year-old plus having anticholinergic delirium from the high dose of cannabis, even with just single exposures.
Wow. Well, I'm glad I asked you that, because it's been no one ever talks about the psychosis with the addiction potential. Everybody's
Alex Berenson wrote the book. It's called "Tell Your Children," I believe it was called, and he wrote the book before the concentrations went up, and he made a big deal about this. And I actually was a little critical of it back in the day because I was like, I'm not sure. Now I'm sure. And when my daughter got sober from cannabis, she got her hands on that book. I don't know how. And she was furious with me. Why didn't you share this with me? Why didn't you show me? If you want to know how addiction works, I, of course, did. She didn't want to hear it back when she was using. So there you go. Anyway, she's a big advocate now, and hasn't missed a meeting since the day she came home and started her sobriety.
What's the name of Alex Berenson's book?
I think it's called "Tell Your Children." I will actually look it up for you.
Yeah, well, he doesn't believe in ivermectin, so but I'll read it. I'm curious.
I wish we would, you and I in particular, but even people like Alex Berenson, would stop using words like believe and just start saying, I'm unconvinced by the literature I've read. Fine, you're unconvinced. Excellent. Mary's convinced. She will use it to the benefit of her patients, and it's well within her right as a practicing physician to do what she thinks is best for her patients. Okay, we disagree. There we go. End of story.
Yeah, you're right. That's a better way of putting it. I've actually tried to talk to Alex Berenson, though, and he will not speak to me about it, which is unfortunate.
That is unfortunate. That's not like him. Usually he'll kind of talk about stuff. That's weird.
Yeah, Jillian Michaels invited him to come on a podcast with me and him and discuss things, and he did not respond. And I've asked him to, but anyway,
hang on. It is called "Tell Your Children the Truth About Marijuana, Mental Illness, and Violence."
I can't. Do you know how many states legalize it now?
I think it's 20, something like that.
It's over 20, I think.
It's, look, I feel about it kind of the way I feel about treating somebody with addiction. You can't force them into addiction. They have to prove it to themselves. Okay, I'm sorry. They're very dangerous. You're going to hurt yourself. You're going to hurt other people. But I'll be here to help when the time comes.
What have you seen in your career, things that you stood by early on, particularly with addiction medicine, that now you look back and say that was all wrong?
Well, certainly the way I thought about addiction when I was doing all that drug withdrawal, I thought addiction was about getting people off of the drugs, which is complete distortion. It's far more complicated, longer term proposition of healing the brain, rewiring the brain, dealing with the underlying influences and the crazy thinking associated with that disease. The other thing is my codependency was pretty severe at the beginning. And I kind of had that thing that people get when they see traumatized people, that they sort of feel, oh, my heart goes out to them. I feel so much. They're so slow. And of course, those traumatized people with the character pathology and addiction would just mop the floor with me, just use me however they needed to.
Right.
And it took a few of those for me to understand how that works and how to set boundaries and how to really manage people who are trauma survivor, particularly with character pathology.
Well, I have a funny story. My very first day out in the real world, and I joined a small practice, and I got this call on a Friday afternoon. This was back when we still had pagers. And it was, it was my partner's patient saying that she ran out of pain medicine.
Oh, perfect.
And it gets worse though. So yeah, I am.
Yeah, but only you can help me, doctor. Only you. You're the best doctor. The other doctors don't understand me the way you do.
I bought a hook, line, and sinker. Okay, it gets worse though, because I was newly licensed, and I couldn't. There was something where I couldn't do the electronic version, or I had to have the triplicate, and I couldn't. And she could. I drove the triplicate to the pharmacy for this woman.
I've got some good therapists, Mary. I'm going to recommend you.
Well, hey, this was day one, and after that, I was. I
had to do therapy. I had to do therapy. I knew I had to do it because I was dealing with really uncanny population that was good. They were good at their stuff,
right.
And so I did therapy for a number of years, and it really helped me. And now I've got like superpowers because I was the object of a sort of very intense trauma-based therapy. It makes me able to trust, in all these years of dealing with patients that just lie and distort and manipulate, that I can trust when I'm working with a patient. I literally can trust anything that comes out of my mouth. It's the weirdest thing. I'll just tell you a story I like telling that sort of exemplifies it. I had this. Can I swear on this show? Because when you talk to addicts, it's always swearing, right?
Yeah. It goes live stream on X.
Okay. So I was dealing with this heroin addict who had come in after an overdose, really barely made it through. He's like a 28-year-old guy. And he was sitting, I feel like he was on the floor or something in my office, crying and sobbing. And his friend didn't make it. His friend died. He barely made it. It was his third life-threatening overdose. And he was like, I'm going to die. I know it. This is terrible. This disease is awful. I'm so tired. I'm just and he was in so much pain, and I could feel the pain he was in. The kid was really suffering. And I liked this kid. I treated him before, and I was very worried about him. And all of a sudden, without consulting my consciousness, my mouth went, yeah, I know. I'm sorry, but you were just so full of shit. I don't even know what to believe anymore. And he stopped, and he stopped in the middle. He stopped crying, and he looked at me, and he went, I know. How'd you know? I don't even know what's bullshit anymore. I don't know. And I thought, we can work. Let's just stay right there. Stay right there. I can see through. I can feel what's going on here. Don't trust anything you think, or don't trust anything. Just follow direction. And we were able to work together because of that.
Yeah. How long did it take you to become, sharp to all that?
15 years, a long time, long time,
Whoa.
long time. Yeah, long time, and years of therapy, and at the early on, another thing I thought I used to do was wrong. But really, realistically, 10 years. I was more confrontative, and confrontation is the enemy in most mental health situations. When you confront people, it just force shields go up, and that's the end of everything. You're just done. So this sort of Dr. Phil world of confrontation, while and I mean no disrespect to Dr. Phil, he has an amazing talk show, but that kind of confrontative style is not psychotherapeutic, and it's good talk. It's not, and people got the idea that that's how you're supposed to deal with mental illness, and I think I even adopted a little bit of that, and that was not right. It was not good.
Well, yeah, but then there's this whole other side of it is, if you don't confront people, are you just enabling them? I mean,
we don't coddle them, and you
Right.
don't lie to them, and you don't. It's going to be more skillful for that. Look, the way you deal. This is a good advice for anybody else with drug addicts, alcoholics in their family. Use therapeutic wonderment. It is exceedingly effective with situations like this. It's like, I wonder if you've ever thought about how you feel after you behave like that, after you've been drinking. I wonder if you ever thought maybe it's the alcohol. I wonder if you ever just, I wonder. I'm wondering, and of course you know the answer,
Right.
but I'm wondering, it works every time. They just can't help but answer. They answer in a way that's more authentic and more realistic and gets them thinking and more motivated to make change.
And you use the I word, not the you word, right?
Correct.
Yeah.
Correct. But I just love the term therapeutic wonderment. It's just, I'm wondering, gosh, I wonder if you're drinking too much. And you got to remember, denial is a very complicated process. It's not one thing, and it's not just lying, though certainly lying is involved with it. My charge nurse and I used to amuse ourselves. We'd need to ask a patient when they come into treatment. We'd see them, for their exam in the morning and stuff. And why are you here? What brings you here? What's your motivation? Where are we starting here? Just always a good place to start with these patients. And we over the years we started amusing ourselves with that question, because the answers would be a million miles from reality. And I remember one guy we sat with, why did you decide to come in? Why now? Why right now? What's your motivation? And usually it's family or some legal problem or whatever. And this guy's like, you don't know how it's living like this is impossible. It's just so painful. I'm sick and tired of being sick and tired. I've been planning this forever, and I'm just sick and tired. And this morning, that's it. I'm done. And I open the chart. There's a picture of him in 4-point chains brought in directly from the court. Like, did the judge have anything to do with you being here? Oh yeah, the judge, yeah, but I'm sick and tired. Yeah, okay, well, I'm sick and tired of it. I mean, it's a biological, it's anosognosia, right? It's the same thing as in stroke patients. They literally distort reality so much that it becomes biological.
Do you think interventions work? Do people still do those? Do people? Yeah.
Say it again.
Oh, do you think interventions work? Do people still do those?
Yeah, they do. They do work in good hands with adequate resources, with long-term commitments, right? You can't just get somebody in for detox and expect that to make a difference. John Kelly has another bit of data out there that's sort of a dirty little secret in addiction medicine, which is that on average for a severe alcoholic, it takes 4 treatments and 5 years to get 1 year of sobriety.
Wow.
So to have repeated requirements of treatment is actually routine.
Wow.
And so
that's hard.
now, on the other hand, if you spend a long period of time in treatment, the outcomes tend to be much better. By long, we're talking 6 months, 12 months, 24 months, that kind of thing.
What do you think about diet, the ketogenic diet for mental health? Have you looked at that at all?
Yeah, I mean, there's some remarkable data on mood, right? Again, people have to, there's kind of a weird thing going on right now, which is serious mental illness and serious medical illness is sort of left the conversation in some weird way. Everyone's got to remember, you're all going to get old, you're all going to get sick, you're all going to need medical intervention, real medical intervention, like full on, whether it's chemo for your leukemias or whatever it is, you're going to need the real deal stuff. Unless you're nihilistic, you just want to let nature take its course. But most people don't do that, especially since we have such good treatments. Same thing is true of serious mental illness. Serious mental illness is life-threatening.
Right.
And you don't have time to fool around with diet. And we're really talking about milder forms of mood disturbances where yes, it does seem to have a significant effect on diet.
Yeah, I agree. People seem to be glossing over a lot of these major issues. And unless you've really dealt with somebody with serious mental illness firsthand, it's hard to imagine.
Most people don't know what it is. They don't know what serious medical problems are either. We've done such a good job of, putting at least keeping it in the hospital or treating it that people don't even understand what it is. For instance, I have prostate cancer. I had a prostatectomy 12 years ago, 14 years ago, something like that. And when I sat down with the surgeon, I did not want him talking about my diet. I did not want him talking about my management of my hypertension. I wanted to know what his complication rate was from his radical robotic prostatectomies. And his answer was 0. And when he said 0, I just want him doing operations all day, nothing else. And I want him to do my operation. Thank you. And that's that.
Right.
And so we can't lose track of these highly skilled professionals. You know what I mean? I'm worried that we're throwing the baby out with the bathwater.
Yep, I completely agree. Are you seeing people microdosing LSD or
Sure.
What's going on with that?
So that is some of the scariest stuff you can imagine. So LSD is the drug, probably the drug that scares me the most, because in having spent all those decades in the psychiatric hospital, I would see the consequences of the LSD, right? People from the 60s that had significant LSD exposure, I ended up putting them in nursing homes. And they were not demented. They were just unable to manage their daily lives. They were profoundly depressed. It was a very odd syndrome. People that have modest LSD exposure typically would come in a year or 2 years later with personality changes and mood disturbances and memory problems. I've even seen normal pressure hydrocephalus from somebody who took a sheet of LSD trying to evade the cops. I mean, this drug is neurotoxic, clearly. And there's actually something called a theory called, I should say, a hypothesis called excitotoxicity, where the thought is that when you are pushing out neurochemicals at an extra physiological rate, this has been shown to be more the case in the setting of amphetamines. When you're pushing out the vesicles, particularly if the mechanism is by accelerating the vesicular release of neurochemicals, neurotransmitters, the vesicles don't form as well. They sort of become dysfunctional in their formation, and the neurotransmitters get into the cytoplasm, and the neurotransmitters themselves become free radicals that destroy the cells. So this excessive stimulation, this idea, oh, you're just opening up pathways. These are things that you're seeing reality, more reality, because this is all BS. You are damaging your brain. You're accelerating in a non-physiologic, non-natural way, and it is dangerous. Right. Could it have therapeutic benefit? Well, guess what? In end-of-life dread, when your life is only a few months left, it is shown to have real significant benefit. Then all these side effects aren't really that relevant, right? Right. By the same token, the microdosing, I have seen all kinds of problems with that. Eventually, the same kind of stuff starts happening, personality changes. And there's this odd literature out there that goes, well, yeah, we see the personality changes, but they seem happier. They seem to be more adjusted. And I think about this. Think about the bioethics of people saying something like that. Right. It is one thing to say you or your personality is changing in a psychotherapeutic environment where you, the patient, are in control of these changes, as opposed to I put a chemical in my mouth and it made me a different person. That is a profound bioethical problem. Right. And the fact that we have literature that passes judgment on that it's been around for 30 years. It's disgusting. Then they have the psilocybins. And then the psilocybin is the one that's less dangerous, clearly. But even that, I've seen people doing it on a microdose daily basis, developing manias. So, okay, not good. Ibogaine or ayahuasca. Of course, all my heroin addicts want to go do that. All except for one, we're back at the heroin within 6 months. And I saw with that also some personality changes, and some of the trips were traumatic and life-altering in a negative way.
What
I'm
about
not using them yet. There may yet be one day use for them therapeutic in very difficult situations. I am gravely concerned about that category.
and what about ketamine? Are you seeing anything with that?
Ketamine is been shown clearly to be useful under and in the hands of an anesthesiologist, 3 or 6 exposures in recalcitrant depression, not as a first line treatment.
Right.
This use of esketamine, the inhalant afterwards, again, that literature looks confusing to me. This idea of doing ketamine therapy under the influence of ketamine looks completely concerning to me. I'm unconvinced by that literature. So while ketamine is very useful, the way it's being used is concerning. And then finally, I've seen it trigger drug addicts. So if you have drug addiction in sobriety with recalcitrant depression, I would not suggest ketamine is a good idea.
Well, great. That debunks a lot of things flying around the internet now. Very, very interesting. We were going to talk about current events, but it went off.
Mary, 1 second. I want to say, when I go out and give lectures and stuff, I usually open with this. I'm a time traveler, everybody. I come to you from a different era. Right. I've been 40 years in these fields, 4 decades. Across that time, I've seen these same ideas that are flying around now come and go and come and go. And some different ideas and some good ideas and some bad ideas. I've seen a million different ideas come and go. I'm a time traveler here in the present to share with you my wisdom as I come forward in time from a previous era. Please listen. I've seen a lot, and it is informative.
Exactly. I mean, that's why I asked you, because, you learn as you go from your clinical experience. And to me, that's much more valuable than a journal article, because as you know, you can find an article to support anything you want.
And it got so backwards during COVID. I was saying this then too. It's like, wait a minute. The doctor's clinical opinion is everything. It's everything.
Right.
He or she then buttresses that opinion with the literature.
Right. Exactly.
But that his or her opinion should not be established strictly by the literature. It should be the literature, the experience, the follow-up on the literature, but the experience is the paramount, and the judgment that comes from that experience is why you see a doctor, a physician.
Well said, and a great way to end. Thank you so much, Dr. Drew.
You got it. Thank you so much. Such a pleasure to be here. And the TWC guys sent me, and so thank you for the support of TWC. We appreciate it so much. That has been an incredible privilege to be part of that organization. They have really pushed medical freedom forward, it seems to me.
I agree. They are very like-minded, and they are the sponsors for this show. And I too am very grateful for their support.
Great. Wonderful. Thank you.
Thank you.